A new study published by the Foundation for AIDS Research finds that counties that are disproportionately white have shown consistently lower rates of both COVID-19 and HIV. It says that even during the surge in coronavirus cases across the South and the West, infections remain the lowest in areas that had the highest proportion of white residents. The report points to residential segregation, structural racism, and social determinants of health as driving factors behind that disparity. Joining me now is the lead researcher on that report, Gregorio Millet. He is the vice president and director of public affairs and public policy, at AMFAR. Greg, it's great to have you with us. Your report found that this is not about people's behavior, which some people might think it is, but it's actually more about the environment in which they live and work. Tell us more about that finding.
Sure, and thank you, Eamon, and congratulations on your show.
Thank you.
One thing that we find is that we see these persistent disparities that take place in the United States. So with coronavirus, we have a new disease, but we have the same disparities. And part of the reason why we're seeing this is because, as William Faulkner said, the past is never dead. It's not even past. And what we could see from our past is that at the turn of the last century, there were programs that were put in place by the federal government that would rate particular neighborhoods as to whether or not they were deserving of federal investment. This is part of the Homeowners Loan Corporation in 1933, where the best neighborhoods were considered an A grade and the worst neighborhoods were considered a D grade. And part of what was associated with the D grade was having foreign-born residents, people who were primarily black or brown-skinned people, or lower-grade populations. So one of the things that we were interested in was if we could take a look at counties today to see what is the proportion of whites in counties, are we going to see an association with COVID-19? And we definitely saw that because we still see overlays of what took place in 1933 with where people live in the United States. So those counties that are primarily white, 88% or more white, you see far fewer COVID cases from the very beginning of the epidemic through now, as compared to those counties that are more diverse, as in 60% or less white. And this is definitely a pattern of residential segregation that we not only see for COVID-19, but you see for many other diseases. We've seen it for studies around HIV. We've seen it for studies in terms of low birth weight babies. We've seen it for studies for asthma, as well as cancer stage of diagnosis. This is something that's part of the fabric of, unfortunately, American society. And unfortunately, COVID-19 is the latest chapter.
And one of the metrics that is obviously being tracked very closely is hospitalizations. Earlier this month, the CDC published a report that found Black and Latino children are more likely to be hospitalized because of COVID-19. How does that square with your research?
Absolutely. I mean, one of the things that we see is, banks used the ways that in 1933, we've had these investments into some of these specific neighborhoods and counties. So for those places that had a favorable rating, you had investments in terms of resources. And those resources also include hospitals. They include healthcare facilities. And to this day, those places that were rated as undesirable, you still see that the hospital situation is not as good as those places that were rated more desirable. If you don't have hospitals, or if you have hospitals that are primarily public funding, where people don't have expertise in COVID-19, your outcomes are probably not going to be as good as those places where there is more healthcare that's available. Another thing that you also see with these areas that have lower investment is that people have to travel farther to their health care. And we know that there's negative outcomes that's associated when you have to travel farther for your health care as well. So it's no surprise when you see the CDC study and you're seeing these higher hospitalizations for Black and brown children.
Let me ask you, and unfortunately we're running out of time, but finally, what do you think can be done on the state and federal level to help address this disparity?
There's many things that can be done at the state and local level. First, we need to make sure that COVID-19 testing is in those neighborhoods where we see most of the positives, Black and brown neighborhoods. We need to make sure that we have greater equity in healthcare for many of these neighborhoods. And one of the things that we could do that is through Medicaid expansion. We know that through Medicaid expansion that you see better outcomes and fewer disparities by race and ethnicity. And those are some of the things that we could do now.
Yeah, I was going to say, and obviously the topic of Medicare expansion is obviously front and center in this election cycle. Greg Millett of AmFAR, thank you very much for joining us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.